Absolutely. Good morning, everyone. Thank you so much for joining us. This is our third listening session, and we are so excited to have you guys. I am Kenyatta Blake Washington, the State Unit on Aging Director here in Mississippi. We also have our partners, Advancing States. They are going to talk about the state plan and how we're going to shape the next 4 years of our state plan. They are helping us develop this state plan as we move forward. So today, basically, we want to hear from you, your insights, your experiences as we craft and shape the next 4 years of our state plan. I see a lot of our area agency on aging partners here and other people that may be local providers. So we would love to hear your experiences, your challenges, your gaps, what's going right, what's going wrong, everything, so that we can ensure that we provide a true picture for older adults in Mississippi. So thank you again so much for being here, and I'll turn it over to Yonda.
Thank you, Kenyatta.
Sure thing.
Oh, and I'm excited to see folks from the AAAs here after being on the ground in the state so much of last week. So appreciate you joining us. So just to kind of go through some housekeeping, this session is being recorded, and that is to enable us to have a record to go back to for reference. And just please bear that in mind. You will have a microphone button on your screen. We will try to keep everybody muted, but you can use that button to unmute yourself if you would like to speak. But please stay muted unless you're speaking in order to help minimize background noise. We encourage people to turn your cameras on if you're comfortable with that. It just helps us know who we're engaging with, but it's not an absolute requirement if you would rather stay off camera. And then additionally, we would encourage you to use the chat feature to ask questions or comments. And Emily from Advancing States is going to be monitoring that. I can't see that chat, so she'll have to let us know if there's a comment or a question. But we do have a period of time at the end of this for open questions. And so if you have broader questions than we address during our meeting, we'll definitely give you that opportunity at the end of this. So we have had our welcome from the director. Obviously, I got a little flustered because the slides didn't work the way we expected them to. But I would also like to note that we have a number of staff from the Mississippi Division on Aging here, if you guys can give a quick wave. And then I'm Yonda from Advancing States. We are the state member organization that works with states on all things related to aging. That might be the Older Americans Act, it might be Medicaid, it might be No Wrong Door, Adult Protective Services. We support states with advocacy, policy work, technical assistance, and we are thrilled to have been working with Mississippi for almost a year now on Older Americans Act requirements and now on the State Plan on Aging. So we're going to talk a little bit about what a state plan on aging is. We're going to talk about the timeline and activities that go into that plan. And then we have sort of some structured questions to start to walk through, but we'll probably veer from the slides at that point, depending on how the conversation goes. So that's our outline for what we are doing today. So let's talk first about what is a state plan on aging. The Mississippi Division of Aging is the federally designated state unit on aging. This is the state unit that every state has that administers services and supports for older adults through the area agencies on aging and serves as a hub of state level planning and coordination for older adults. They're really the state experts in aging in state government. The Older Americans Act requires state units on aging to do a plan every 4 years in order to outline their goals and objectives for that next 4 year period. as well as provide assurances of compliance to our federal partners. That is the Administration for Community Living, which is currently a division within the U.S. Department of Health and Human Services. Those goals and objectives are really the heart of the plan, and those are based on community input as well as the division's analysis of needs and priorities for older adults and how they are aging in their communities. This listening session is a part of that community input gathering, so that's why we are here today. We'll be doing community input and data analysis through October of this year. This is the third of the listening sessions. We were on the ground meeting individually with all of the AAAs last week. The other big element that is out there for community input is a survey. And the last slide that we share today will contain a link to that survey that will be out in the field through the end of this month to gather even broader community input from all types of persons in the state of Mississippi. We'll start drafting the plan probably more like November through March. We'll do a deep dive into that analysis. We'll work with the team on writing their goals and objectives, writing the other narrative pieces that are part of this plan. And the plan will go out for formal public comment sometime March, April of early 2026. AAAs will see a version probably sooner than that, probably in January. As we finalize our goals and objectives, we'll send a draft version out to get early input before the formal public comment. We'll make revisions based on that public comment, though, in May of 2026. Ultimately, submission to the federal partners in July. That's supposed to happen by July 1. And then the plan will be effective, assuming it's approved, no reason to think it won't be. Assuming it's approved, it will be effective from October 1st of 2026 through that 4 years that ends September 30th of 2029. So everything is done on the federal fiscal year calendar. I've already said this is what we're doing on community input. So what I'd like to get a sense of is folks who are in the room with us today. And you can either like wave, you can use the react buttons on the bottom of your menu, you can come off mute. We're not going to go around and do individual introductions because we want to get to the Q&A portion, but we would like to have some idea, if we can, of who's joining us today. I know we have a number of division staff here, and if you all can kind of again give us a little wave. And then how many of you are here from area agencies on aging? And then how many of you are here as a member of the contracted service providers around the state? Hi, nice of you to join us today. Thank you. And then is there anybody here who is a caregiver or a member of the community that is not in the AAAs or not a service provider? Emily, did anybody show up in that? I can't see.
No.
Okay.
We had some service providers and some AAAs.
Yep. Great. That's fabulous. So that just is good to know who we're hearing from. So with that, I'm going to start the discussion off with some questions. In a somewhat random fashion, order is not related to priority here. What we have tried to do is bucket these discussion questions into sort of broad topical areas just to kind of help support the discussion. And so the first bucket we wanted to talk about is about services and supports, and learning more about where people reach out to get help if they need help due to illness, dementia, increasing frailty. So if you're here from a AAA, if you're here from service providers, this is the point at which I'm going to start turning the conversation more over to you and use the questions to sort of guide that. So you can either come off mute and speak with us or put your comments in the chat and Emily will share them with the group. But what are your thoughts about how people know where to reach out to? Who are they turning to when they need help? One of the things that we hear around the country is that the area agencies on aging are often a well-kept secret. Um, Although we know that that is a core hub for people to turn to. Do you think people in Mississippi know about the area agencies on aging that are available to them? Is anybody trying to come off mute?
Good morning, Yonda. This is Dr. Criddle.
Hi, Dr. Criddle.
Good morning. Could you ask that question one more time for me?
We're trying to understand the extent to which people know where to turn to when they need or think they need assistance, and not just know where they know where to turn to, but where do we think they're actually turning to?
I cannot necessarily say where they're actually turning to, but I'll speak for Central. We try to do a good job in terms of getting the word out. I do see on the call some of our local service providers that we contract with. So in each area, there's an outreach worker, there's an I&R worker in those areas, along with here at Central, we have staff, and we try to work to get the word out and the information out. Unfortunately, our budget is not large enough that we can do a lot of media, that we cannot get the word out that way. But we do have other avenues within the agency that we attend health fairs, we attend events, and through those means, we try to get the word out, and we have our brochures and handouts in terms of trying to pass out. And one other one other group of people that is a good avenue for us to utilize are our clients. Our clients do spread the word for us. Once they get help, they share that information with their neighbors, their church members, other family members. So that word of mouth tends to help a great deal as well.
Thank you. Does anybody else on the call have any thoughts?
And remember, guys, this conversation, this is for us to gather information from you and your input. So we definitely need you to respond. If you can put it in the chat, you don't even have to come off mute. If you can just type it in the chat, and Yonda will kind of just talk us through what you're saying, because we do want to document all of your comments as it's going to shape our state plan and what we're trying to do for older adults.
Kenyatta and Yonda, one of our local providers, Yazoo County Human Resource Agency, has put in the chat that her clients, and Heather is one of our outreach workers, her clients turn to the library, doctor's office, home health agencies, and again, word of mouth.
Library, interesting. And some go directly to home health agencies. Okay, that's interesting. And then they can be referred to, if needed, to the AAA for assessment and publicly funded services. What types of things do you think older Mississippians need in order to be able to age in place in their own homes or with their families? What types of services are of the most value? What is the most demand for? What do you think they are in need of? And again, you can come off mute to answer that or put things in chat. Emily, is there anything going in chat right now?
From the last question, there was response churches are also a place where people go. And then food services and caregiver services in response to your most recent question. Transportation as well.
Transportation, yes. And we've got some focused questions on transportation. Hold on here. That's actually the next slide. So let me go ahead and move that direction. How are older adults getting around the state when they are unable to drive? What are the resources they use the most, and what do they need the most?
Heather added again. There are several clients that need right now assistance in the home after hospitalization or surgery instead of homemaker services. And then for transportation, area caregiver service, meals and transportation, family or friends several times was mentioned for transportation. A need for weekend transportation options was expressed as well. Family, neighbors, friends rely upon transportation.
You know, I know from being on the ground last week, very struck by the amount of distance we traveled between towns when we were driving around the state. Some of it may have been route, but we drove through a lot of very rural areas. I was very struck by the fact that we rarely had a drive that was under 2 hours. Most of our drives were what, like, to rely on family and friends, is there anything that can be done to help support those family and friends who are supporting transportation? I'm not sure public transportation is the best, is super available in rural areas. I'm just trying to think of, are there any sort of local initiatives or out of the box ideas that are happening at the local level that we should be aware of that might help support the family members and neighbors who are providing transportation?
There's something in the chat. Many people are paying $50 out of pocket for a ride from Yazoo County to Jackson for doctor's appointments. When they learn about free transportation offered through AAAs, this is life-changing. Family and friends often take advantage of a vulnerable situation.
What was that last comment?
I'm just making a comment about how people might take advantage of a situation, family and friends, when it comes to transportation.
Can we talk a little bit more about that? Can you like expand on that in the comments or come off mute and tell us a little bit more about what you mean by take advantage? That can be good or bad. They're either taking advantage of resources or they are exploiting those resources. And I'm just trying to understand where that's coming from.
Excuse me. My name's Heather Gray. As Dr. Criddle said, I do outreach for Yazoo County Human Resource Agency. And in our town, I would say exploitation of a vulnerable situation. I meet so many, and it's a joke, but it's not a joke because it's not funny. The going rate for a family member to take you, 36 miles to Jackson for a doctor's appointment is $50 plus lunch. And that is pretty standard. I can pull the number $50 because I've heard it so many times, plus lunch. And whenever I meet these clients and I'm like, hey, because, we're serving a population that is on a fixed income with limited financial resources. They cannot afford to pay every time they need to go to the doctor, but they've been doing it. But when they find out about these AAA resources and that it's not going to cost them $50 every time they need a ride, it's almost emotional for them. It's a very huge asset to our county and our community, and we are appreciative of it, as are they. But you asked about how can you support those neighbors or family members, on one hand, I'm saying, well, maybe, if there was a program to pay them mileage, and I'm thinking, well, a lot of them still may charge that patient, that elderly person, out of pocket.
That was actually something I didn't completely understand about your comment. So you're saying friends and family members, like people in the community, are charging older individuals $50 plus lunch to take them.
Yes,
I
ma'am, on
get
a
it.
regular basis.
I get it. Okay. How does that compare to the transportation rate that people are often able to get, like that you end up paying the providers for those services?
Hey, Miss Yonder, this is Roderick up from North Delta.
Hi.
So a lot of the transportation providers we use, we typically don't transport out of the county. So that makes it a little difficult for some of those individuals that wants to go across county lines. And of course, I have been in situations where we have checked on those rates, and they're pretty expensive
Okay.
because most of those individuals that are providing transportation services, you have to look at the capital they have in hand, whether it's the buses, and then the human capital that's working, and of course, a piece of maintenance and also traveling expenses, gasoline, and it can get very expensive. I've talked to a person that needed dialysis and give an example. They wanted to go across maybe one, maybe two counties, and they were looking at roughly about 85 to $100, per trip.
Wow.
I'm fine. How y'all doing?
Roderick, the county line issue, is that because of the funding sources that are involved that prevent providers from being able to go across county lines?
Well, it actually is a little more to that. It of course it is funding because once you are traveling outside of that county line, as I just said, it's more expensive. But at the same time, your local officials, they're looking at the tax base because most of the time when individuals want to go to different places, they want to go shopping, and that's taking potentially. That's what one of my providers did a survey, and that's taking representatives from one county spending tax dollars in another county, and it just doesn't work out well sometimes, and it causes a political, divide in the area.
Does it matter
They
if the
going,
trip is for medical transportation versus like
they going to the
errands and
church?
things like that?
I haven't heard too much. I know the one that we did a survey on, a
Somebody
lot of
died.
our people that we deal with is really not medical transportation. It's basically they want to go to different areas because the
Thank you for
shopping
that.
may be more diverse in another area as opposed to most of the time in my area, to be honest, when it comes to medical transportation, a lot of the individuals that we service are receiving Medicaid, so they can use the Medicaid non-emergency transportation. So that helps with the medical side. It's just more of that leisure shopping size for the more diverse shopping that's brings the issue for us.
Okay. Emily, are you seeing anything in chat?
No, Brittany made a comment about transportation
Uh,
starting from doctor's offices.
no, that's everything. Okay, thank you.
Please
If
ensure
you
that
are
your phones
not,
are on mute.
yes.
If you're not speaking, please ensure that your phones are on mute or your computers are on mute. We're hearing a little background noise.
Kenyatta, that's Sharon Dallas. I've been trying to reach her to get her to go on mute, but I don't have access to put her on mute. Can someone at your office put her on mute?
Emily, can,
Yeah.
yeah. Okay.
Okay.
Thank
Okay.
you.
Thank you.
Thank you.
For those of you who are here from service providers and AAAs, is that like what Roderick just described, where this is less about medical transportation and more about personal errands? Is that consistent with your experiences as well?
Yonda, could you ask the question one more time?
Roderick was just sharing with that most of the transportation needs that they experience, that the people that he serves, they're getting their non-emergency medical transportation handled through Medicaid. That where there is a real transportation need is more for personal errands. Is that consistent across the state, or is there a lot of unfunded medical transit need?
Hmm. Maybe let me see if one of our providers would chime in that are actually, if I can get one of them to chime in that's providing transportation services. I think I saw Mr. I'm sorry for calling you out, but I need you all's help. I can answer a question, but I prefer one of our providers to answer it. I saw Mr. Cooley from Copiah County on there. I saw Mr. Luttrell from Hinds County. And I know Yazoo is on there. I see Miss Weathersby from Madison County. So if I can get one of the providers to chime in before, and then I can add to it from what I'm seeing.
Yeah, we do hate to put you on the spot. If you're not comfortable, we would, you don't need to speak, but your input would be really helpful to us. And you can either come off mute on your screen or put your comments in chat.
There is a comment in chat talking about the Medicaid transportation option. Some people are running into a problem with Medicaid because their transportation does have a limit. So they won't always be able to use the non-emergent services Roderick was referring to.
Oh, this is Roger. I'm with Hinds County Human Resource Agency, serving, of course, Hinds County. And so we're talking about transportation for other needs outside of medical. So we have a rule 5311 public transportation program, and private pay option there. And so anyone in the rural areas can come into, the city or the metro, or I think the only stipulation on our side of our public rural transportation is that the trip either has to begin in the rural or it has to terminate in the rural. So we normally pick people up in the rural Hinds County and bring them into the metro for whatever they want to go to. Planet Fitness, their sister's house, Kroger to get medicine or medical appointments. So then there's that. And then, of course, the Title 20, which is through CMPDD, I'm sure you're aware of.
I ran the state unit on aging in Indiana, but probably the area I spent the least amount of my time on was transportation. So this is illuminating. It really is, it is helpful.
And then we also have a large service contract with the city of Jackson, Aging and Adult Services that provides, transportation to those in that program, those participants, and that can be inner city or where throughout Hinds County, wherever it is that they need to go for any purpose.
Are there any service providers here for other rural areas that have anything different that you'd be willing to talk a little bit about?
Yes, this is Sharon from Madison County Citizen Service Agency. And I just want to add, not much I can add other than what's been said. We have the Title 20 and we also have the 5311 general public with MDOT. And we serve Madison County, and however, we also do have routes to Jackson, and that's on that's set at a reduced rate. I'm not the expert here on with our transportation program, but we do have our other rural areas where clients can use our transportation services, and we're in certain parts of the county on certain days. That also helps, like the we have this area called Farm Haven and Sharon, who is outside of our Canton area, but still in Madison County. It's not in the city area, but in other parts of that's way out. We have certain days that we're in that area, and they can book transportation for on those days to go to Jackson to doctor's appointments or to come to town and pay bills or come in for other services. And so that's kind of in a nutshell of how our transportation works, but it is a problem here in Madison County in the rural area transportation. I also saw in the chat transportation is needed on the weekends as well, and that's something that our agency does not provide the transportation. We do it on Saturdays, but and it's on demand. We do demand trips that can be on Sunday, but to have a regular route on the weekends, our agency do not, but we can take demand calls.
Are the 5311 and the Title 20 programs, are those running pretty close to capacity, or is there space? Are there limitations to people's ability to use those?
Ours is run, I think, to capacity, if I'm not mistaken.
Roger?
But there is room, they have to call in at least 24 to 48 hours in advance. And most of the time, is running, we have to refer them to someone else because it's running to capacity for us.
Yeah, and we're running to capacity in regards to our capacity.
Okay.
So yeah, I mean, if we get new drivers in, then we can increase our daily trips, and we lose a driver, then we go back down. So
Okay.
it's the limitations are really also the ability to match. 5311 through MDOT has match money. So those service revenue contracts and ridership fares, things like that is a barrier to that program to match and to continue to build capacity.
And see, Miss Young, it's a little different in my area.
Mm-hmm.
I would say we're probably not at capacity, but comparing my North Delta area to Chelsea's central area, which is more metropolitan, I only have one provider that's covering, my 7 counties. So, and plus they have issues where there's coming to now since after COVID, keeping workers and drivers to have the routes, and then also putting that capital outlay to have a bus and a driver that may be in a rural area that may only see maybe 15 trips or so, whatever. It's just it slows them down because they don't want to be in a losing situation. But
Right.
it's one of those situations where it's the cart before the horse, because you got to do something if you want the transportation to get to that level where it's maximized. But it's just one of those things here.
Yeah.
Yeah, I wanted to add, at Central, we do have an assisted transportation program. And this was put in place to address some of the concerns that came about from one of our public hearings, that the seniors were always in need of transportation going across because the doctors were moving out of Hinds County, out of Jackson. They were moving, say, more to Rankin County, or they were crossing over into Madison County. And again, that political agreement or those challenges based on them not being able to, the bus is not going from one county to the other. And so therefore we put an assisted transportation program together to help for medical appointments. And we work through that, and that's handled by CMPDD directly. And it's to help people to get to dialysis appointments and to medical appointments, critical medical appointments based upon people needing to go from one county to the other. And that is, like Roger said, that is a very expensive program.
And you fund it through CMPDD or?
No, we are using we're using funding.
Okay.
Not directly. CMPDD matches the money, matches the dollars that are utilized through the federal funds.
Gotcha.
This is Heather from Yazoo County again. And I would say locally, we run pretty well. We stay busy. There's no downtime for sure. Our locals, as far as local trips, are pretty well adjusted to how we operate. And then most of the time, those are needs like going to the grocery store or something, and it's very flexible. And medical appointments locally, we service very well. But we do not have specialists in our county. So there are a lot of appointments that are outside of Yazoo County, and we try very, very hard to service that as much as possible. The days that we go, we are a lot like Miss Sharon, where we offer on certain days that we can go based on how many drivers we have on that day and such. But the need to leave Yazoo County for a doctor is growing exponentially. And a lot of times that need is also paralleled with the need for a handicap accessible vehicle,
Oh, yeah.
which carries fewer people. And when you are carrying fewer people, then you're telling people more often, my van is full that day. We can help you reschedule. Can I offer you some dates when I see that I have openings? And most of the time, our clients are very understanding and we work well with them on that. But the demand for leaving our county is growing, and our ability to accommodate them quickly is diminishing because that need for handicap accessible vehicles and our limitations based on, the way our agency is ran and our staffing and all. We do very well. Our clients are great, but it is a growing thing, and I foresee it growing even more in the future. So, as far as capacity, that would be for my director to answer, but I'd say we run pretty busy. So
Thank you. That's great to explore that. Anybody know of anything that's kind of neat happening at a local level to help with this in other areas? I just want to make sure we're not leaving any stones unturned before we start to kind of move on to another topic.
Well, I think we talked about it when you were here, Miss Yonda, but
I think so, yes.
one of my more affluent counties, they do allocate extra resources and funding to kind of do extra resource transportation in DeSoto County. But that's one of my more affluent counties. Some of the other rural counties, they haven't stepped up to the plate and provided those resources to help with that. So.
Yeah. Okay. All right, so we'll go ahead and move topics. And again, not necessarily in any order of priority, but bucket wise, talking about food and nutrition. And I know the AAAs, I know from speaking with a lot of the AAAs last week that congregate meals can be a real challenge in Mississippi. So we were hoping to hear about like people who are actually receiving meals and kind of learning from that experience. But can we explore food and nutrition a little bit? Understand more about the challenges with getting people to congregate settings. Are you getting any feedback? Do any of the AAAs, I should have asked this last week when I was there, do any of the AAAs conduct surveys of people's experience with the nutrition programs?
Yonder, that is an area, I'll speak for Central. That is an area that we are, a goal for us to explore a little bit more. We do have these surveys at the public hearings, where we do receive feedback from the seniors, but our local provider agencies, they get more feedback from their clients verbally, probably not in a official survey, but it is the seniors are very open and they are very verbal, and they do tell the providers what their needs are, because the providers do share that with us here at Central, and we try to address those needs as quickly as we can, as to what they may need. The nutrition site managers are in constant contact with our staff here at CMPDD, the nutrition staff. So that is a constant communication that is there for us. But as far as having some type of written document where we can give you strict data, we can do more qualitative data as more than quantitative data as far as with dealing with the complaints.
Okay.
But that is an area that we do plan to address more written surveys within our sites.
So those of you who are service providers, can you share with the group, either come off mute or put it into the comments, what people are telling you about either going to a congregate setting or receiving home delivered meals? Don't be shy.
Hi. Okay, I'll go. This is Sharon again from Madison County Citizen Service Agency. We have a congregate site and we have about 20 seniors that are on our roster, and they are very appreciative of the congregate program. It gives them a chance to get out of the house, have a nutritious meal, engage in activities, health. They receive health information. On site we have where someone comes in and talk to them each month about different health and wellness as well as self-care. They have planned activities. So at our Congress site, our participants are really, really appreciative of that program, and they enjoy the meals. And we do communicate with them about the meals, and they they are very verbal in telling us what they like, what they don't like, any of the meals that they don't like. And so that information is given to the nutrition coordinator at the AAA. And so but our seniors are really appreciative of the program, and they don't have basically any complaints. That's it.
We used to hear in Indiana that people like really didn't like the food because it wasn't well seasoned enough.
Hey, Miss Yonder, this is Roderick. I think at some point we went through that too, also here in Mississippi. But the provider that we work with, I think we've worked with them well enough, and they made changes and give us a different variety of options so we can select meals that our constituents like in our prospective areas. I know for us, we don't do a lot of surveys, but as Chelsea said, all of our site managers are hired by the PDD AAA. So we do have constant contact, and we're also in our sites at least once or twice a week. So we are having uh, informal contact with those clients, and they're letting us know if it's the northern beans they don't like or whatever the particular meal is. They're letting us know, and we're conveying that information to our providers when we are having our menu meetings. So I think our meals have come a long ways from what they used to be. If I would take a stab at it, I would say the majority of the people in Mississippi are enjoying the program. Of course, we talked about the grocery boxes here in my area that they actually love, but that's something that we can only do on limited basis. But all in all, I think the nutrition program is going well. Um, if we had more funding, we probably could serve more people to help with those grocery insecurities we talked about in our area. But all in all, I think it's going great.
You know, for other AAAs that might be here, I do remember Roderick talking about the grocery boxes. Do any of you offer that as an alternative to meals in your areas? We only heard about it in the one AAA. Sorry, Chelsea.
We offer it, but it's not an alternative. They get that in addition to at the congregate meal site. So it's in addition to that's being offered. So Trio offers packs the grocery boxes and delivers it to our congregate sites. Now you may want to hear from one of the congregate sites that are from what I'm hearing, the seniors love it. But you may want to hear from actual one of our providers to see what they're hearing as well.
Okay, this is Sharon again. At our nutrition site, the seniors are again appreciative of the grocery boxes. They are, in addition to the pre-plated meals that they receive those boxes. They have been receiving those boxes twice a month, and they are well received. They're well appreciated in advance to the pre-plated meals that they're receiving. So we haven't had any complaints about the grocery boxes other than can they get more? And so I've explained that to them, but there are no complaints from our senior site about the grocery boxes. And when they do have complaints about the meals, we take them back to Trio, but as Roger said, I agree with him. The congregate meals from the commissary have come a long way, and I'm over there at least twice a month and in communication with the site manager. And so they have favorite meals, but the meals have come a long way, and they don't complain as much as they used to about the meals.
Can we spend a little time talking about congregate meals? I heard a lot last week about that congregate meals never really bounced back after COVID. What are the like, and ACL really emphasizes the C1 funding and the value of congregate meals to combat isolation and promote interactivity with others, in addition to the ability to get that, that nutritious meal. Why is participation down? Why has participation remained low since COVID? Because it sounds like most of the programs either aren't at capacity or are closing because they're struggling to really have enough participation to make it, uh, a worthwhile enterprise. Is that, can we unpack that a little bit? For the service providers in particular here.
This is Heather with Yazoo County. One, I do want to say after COVID, our numbers were down, and Central Mississippi PDD, they implemented programs that really helped us grow our program, like a Taste of Central. Like, it just took off. They worked really hard. Miss Sharon Dallas was an asset also in aiding with the creativity and all, making it more attractive here. On the outreach level, what I find a lot of before COVID, but more so post-COVID, is talking someone into coming even the first time. The willingness to leave their home and go to a program. I can make it sound like, a party or a circus or as fun as anything, but the oomph to get up and to leave the home. I think sitting there during COVID kind of put in a level of complacency of a sedentary lifestyle. Like, this is just what we do now. We just sit. And there's also still a lot of fear about COVID, or I don't go around a lot of people. I hear that a lot. Or do they wear their mask down there? Or I hear the COVID numbers are up. I hear a lot of those things that COVID still has a hold in the mind of a lot of seniors. And I understand it is still, a threat to so many immunocompromised and all. But it's almost, they feel as if they step outside their door, they're going to catch COVID. A lot of misinformation, but also a lot of complacency. So a lot of people would rather have the home delivered meals, whether they're eligible or meet that criteria or not, just because it comes to their house. It comes to them. But like I said, our numbers have grown. Central Mississippi Planning and Development has, made sure we had all the resources we needed to, work toward that. Our program, they love it here. They love those grocery boxes. They love the activities. They love the staff. But getting someone to come for the first time, and I always say this when I'm doing, an outreach assessment or meeting with someone at their home, I'll say, my challenge is to get you to come one time. You come one time, you're going to come again on your own. But getting that first time is often very difficult.
That's a great insight.
Yonda, we also had some comments Brittany from Puckett said, we have a few that signed up this past week at the Puckett location. Attendance is up. They're always happy to meet and congregate together, and sharing a meal with someone brings warmth. Northeast said, well, I think this was to a previous question, not on a regular basis, but they love them. So I think referring to the meals. And then earlier, Brittany from Puckett also said, ours are very verbal, so the older adults in their sites are very verbal. So if they don't like something, they will share that. Some even make suggestions on what they can do to make the meals better. And then Sheila, she also made a comment earlier saying that the clients enjoy their home delivered meals and that they are tasty meals.
That's great. What are other resources that you end up having to connect older Mississippians to access food in other ways? And are there enough of those resources?
At Central, we have a food pantry. So that's one avenue that we do utilize, is our food pantry to connect people to that resource, especially if they need something right away. We also have through, say, some of our other programs that we have, we may put funds up for emergency situations, whether it's through emergency services, whether it's through case management. We have funding allocated, set to the side in those programs. So if somebody needs food right away, or something in that avenue, we can get it immediately for them. So we put plans in place that if somebody's hungry, we're going to try to make sure that they have something to eat until we can get them on whether the home delivered meals program, or we identify other resources. So our case managers work in that area, as well as our outreach worker. There's money there set aside for the outreach worker in the area that she works in. So we have multiple avenues to get them food right away. We also can work with food banks through our MAC Center. Our MAC Center has avenues where they can reach out and we can identify food locations for individuals as quickly as we possibly can, so no one goes hungry, especially if they have a need. We also have through here at CMPDD, we have a Center for Seniors project. So through our Center for Seniors project, people give us companies may give us gift cards, and we hold those gift cards just in case it's an emergency and we need to get somebody food right away. So our staff can come into my office and get a gift card quickly to go and satisfy that need. So we try to put things in place to address those things as quickly and in emergency situations as quick as we can.
This is Sharon again. I would like to add that our agency partners with the Mississippi Food Network to provide food boxes to seniors once a month, and our agency provide those boxes every fourth Wednesday of each month to seniors that may have food insecurities, along with the congregate meals. When our outreach worker goes out to screen those clients for services, she informs them of the other resources if they're, if they qualify for the congregate meal program. Of course, that program is, they're giving information about the congregate meal program, but other food and local food pantries here. We have a agency that provides, it's called Our Daily Bread, and they provide hot meals each day to seniors. It's on a first come, first served basis. Not just seniors, anyone, but it's on a first come, first served basis here in our county, and as well as the commodity supplemental food program that is provided through Mississippi Food Network in partnership with Mississippi Department of Human Services.
Kenyatta, is that Mississippi Food Network? Is that a group that you guys have direct connections with? Does Benet work with them at all, or?
Benet, do you want to hop on and speak to that? She's coming out.
No, we do not work directly with the Mississippi Food Network. They do have some type of relationship with economic assistance, and the person prior to who's there now, we were trying to get some things in place, but unfortunately, it's part of the economic assistance division of the agency. So once we can identify, and hopefully at some point we can get those communications back going. She retired, so there are other entities too, because they were interested in doing a mobile food truck as well with some of the funding, because of course they get a whole lot more funding than we do, of course, with the Division of Agents. So hopefully, once economic assistance can get fully staffed, we could try to get those talks back going to definitely offer that food in those most rural areas. But their biggest thing, of course, with everyone else, is no pay. So you need volunteers. So we'll have to see how that works.
Is economic assistance the group that helps like processes SNAP and TANF applications? Okay,
Yes.
perfect. Okay,
There's something in the chat.
thank you.
At Northeast, there is Pay It Forward account if someone is in need food immediately. And the North Mississippi Rural Health Clinics has a food drive monthly where the case manager goes, assists with her, sorry. The case manager assists with to deliver her clients to this monthly food drive, it sounds like.
Do the case managers in the AAAs help people with SNAP applications and things like that? I know some states have programs where, and it may not happen in Mississippi, but some states have programs where there actually is a little bit of pay from the state to people who help folks with SNAP applications.
There's a comment that says yes from the same person who responded about the other food resources.
Ms. Yonder, we don't have any case management personnel in North Delta, but if any senior calls in with any requests, we adhere to it at the best of our ability. So if they call in with SNAP application, we will assist with that, or whether finding the energy assistance program. So anything
yeah.
that the senior needs, we'll help with it when they call in and request from us.
Okay. All right.
And here in Capat, we also does the same thing in our information and referral personnel takes care of that. Anyone in the office can do it, but the information and referral, we normally have her to. But they have a book where with all types of services in the area, whether it be food, transportation, if we're not able to do it, and really we try to keep up with anything that's going on that could assist in any way. We try to have the information to be able to share with them.
Mr. Cooley, that brings up a point that is not really addressed in these slides, but I would love to kind of pull on this thread a little bit. And we're doing really well time-wise. Does each AAA maintain their own individual, like INRA type resources, or is that administered through the MAC centers? How do you stay current on all the different things that are out there that you might end up connecting people to?
So North Delta does not have a MAC center, but we do keep our resource manual updated ourselves with any assistance providers that are in our area.
Yonder, this is Chelsea. So it's Central. We do contract out our INR services to several of the service providers that are on the call. I do see all three of the INR service providers are on this call. We do contract with them, so they keep up with their resources in their area. The MAC Center also keeps up with resources in their area. The MAC Center also produces a resource guide annually, an annual resource guide, and all of the provider agencies, whether it's INR, whether it's outreach, they're required to have a resource guide. They are required to update their resource guide every 6 months. So that is a part of monitoring. When we go in, we're looking to make sure that the resource guides are updated and they are current, as well as here at CMPDD, we also have a resource guide, not only through the MAC Center, but here at CMPDD. And when our staff learns of new providers, is shared, so everybody will be aware of those different resources, and we try to keep those combined so everybody is aware of those various resources.
Are those guides, are those typically printed resources or are those electronically maintained?
Both.
Okay.
So the MAC Center, because it's 4 MAC centers, that is, they have a database of probably over 6,000 statewide resources in there. But here in Central, our MAC Center produces a hard copy resource guide, because people around the area call in for copies of the resource guide. But at our provider agencies, their staff has a resource guide that is printed for everybody in their office to have a copy of.
At North Delta, Miss Yonder, we don't per se have a publication of our resource guide, but if individuals do call in request copies, we will PDF portions that they are referring to, and we'll email it to them also.
I mean, I think hard copies, I know people want that in their hands, but it sure seems like they get out of date really quickly, and that's a very expensive way to produce information. Um,
Yeah,
and
that's the
that,
exact reason why we do the PDF version of it, because we talk about it all the time, and we tell some of our providers, we may have talked to this provider the previous week, but next week they may be gone. So, we do make that acknowledgement once we send it out, because you just never know what's going on with these providers and how their business is operating.
mhm.
And that's true, but when our clients, those are some things that they request, and it is a big request in our area, is that people like the hard copy, as opposed to everybody's not as savvy on the technology side. So the hard copy is pretty much kind of what we have, but most of these numbers that are in there are going to be like state agencies. Those numbers aren't going to, go
Right.
out as quickly. Emergency numbers, other things of that nature would be included in that guide. But it is a big request, especially at health fairs, that people are. So we print thousands of those every year, and they are distributed at health fairs, and it is a big ask.
Yeah. No, I know that. I know they can be really popular. Emily, are you seeing anything else in the chat?
Just another comment agreeing with what Chelsea was just explaining about how most clients are not tech savvy and smartphones freak them out. So the physical copy is ideal.
All right. Thank you for letting me tug on that a little bit. So another bucket here is about just the topic of elder rights. And many of you that are on here, if you're from a AAA, if you're from a service provider, you may be caregivers yourselves. We all have older family members. Do you know anybody that has been taken advantage of through financial fraud or one of those scams that are out there? Do you know anybody that has experienced abuse or neglect? And that was a question, sorry.
Good morning. This is Anita Pig from Yazoo County, and we see a lot of clients that are self-neglecting. And I have in my family, my dad had some financial fraud and was scammed out of some money. So it impacted his life and his wife's life greatly. And so anyway, tried to take some measures to prevent that from happening. And I told them, call somebody, discuss something before you make a decision like that, or take some action and ask questions. Don't just assume or because they played upon their vulnerability. And so it's hard to witness that. And just like the neglect, we see clients who want to stay at home longer, but yet they're really they live alone, but yet they're incapable of really, it's on that borderline of being able to take care of themselves. And that's hard for us to have to watch that and go through it and encourage them to try to move in with a family member. But they're still just reluctant to do that.
What are other, like, do you try to connect them to other resources? I mean, and anybody else on here too, chime in, because self-neglect is a really tricky issue.
Yes, ma'am, we do. We make referrals, whether it be for try to get more services in the home for them, reaching out to even volunteers, just if they're open to that. But, people want to be private and they're not trusting of others. And then you have people who can take advantage of the elderly too. Like we hear this a lot, Heather and I do, that some of the family members only come around at the first of the month when they're getting their paychecks. And so but their clients are aware of what's going on. And so we encourage them, we can't get too much into their personal business in that aspect, but, just encourage them, to protect themselves the best that they can.
Ms. Anita, I would like to chime in. We do refer to APS when we know about situations of like financial exploitation and all. We do make the proper reports, but we also, like she said, encourage resources and, other family members stepping in and even try to be there as much as we can on a personal level, sometimes to our own detriment.
Yeah, that's hard. These can be like really tug at your heartstrings quite a bit. Does APS have resources to help people in self-neglect situations in Mississippi?
This is an experience I have had. I want to say APS is great, and I've seen some, great things that they've done, but I also am not well educated in how they operate. But there's one gentleman that, she was referring to the self-neglect, cannot really stay at home by himself, but is of his right mind, can choose to and all. And we refer to APS because they have resources, to my understanding, such as like some in-home care or assistance with utilities and things like that. And a social worker come out, and then nothing happened. And so I don't know what the threshold is for them to step in and, exactly what their qualifications or what they consider. And I know that some things are absolute emergency. Things have to happen right now. There are other cases that, need monitoring or, aren't really. So I can't do their job for them, but there are some cases where I've questioned why, but I know they have resources. And, I'm involved with a family right now that we reported to APS for like the financial exploitation, and they stepped right in, to work with the family or to get the proper authorities involved. I mean, they're on it, but they have resources. I'm just not always sure of how to get them connected properly.
We have our APS team, the director, the direct service coordinator, the call center supervisor on the call who can speak to all of this great information that you guys are bringing up.
Okay. Absolutely. We do have our direct services coordinator on as well, who can give you some information about the services that we offer to vulnerable population here in Mississippi. And we also have our call center supervisor who takes those reports that you may be calling in some of the situations we have to work with. But I'll let McGay share with you all some of the resources that we have with APS.
Good morning. I am the Direct Services Coordinator, and our program has been implemented for about 2 years. And what we did, we provide services to clients, our vulnerable clients who were needing transportation or utilities or food services. It was at one point open to the public. With limited resources that we have now, it's strictly for our vulnerable clients with active open investigation cases. Did that help clear up any questions? I was kind of working on something else. I don't know if I came in the middle of it or not.
If somebody was referred to you and they were determined to be a case of self-neglect, would that close their case at that point and you would hand them off to other entities for potential help, or would that keep them in your pipeline for assistance?
With the services, it wouldn't necessarily close the case. It's up to the social worker who's assigned to that particular case exactly how long and what resources are needed. But we do try to make sure everything is done and completed before the case is closed.
State units on aging are, it's not a lot of money, but it's a little bit of money through Title VII to spend on education and prevention activities. What are the types of things that might be important to help prevent abuse or financial exploitation that the state could potentially do with those funds?
Anita?
Okay. Oh, I'm listening. I'm sorry. Well, we were set up initially to do some prevention, but now we're just focused on those investigations where we have individuals that have open and ongoing investigations. So if we get a report of abuse, neglect, or exploitation, then we are willing and able to assist those individuals. But we're, like Magay said earlier, we're no longer open to the public per se for direct services. And in addition to, I think someone said, a lot of times when we get those reports, there's the appearance that there's nothing being done, but we have to keep in mind that vulnerable people or elderly people have a right to self-determination. So they can accept or refuse services, even though they need them. We try to encourage them, but sometimes due to personal issues or preferences, they choose not to accept those services. So sometimes if you see something not being done, it may be at the client's wishes that nothing be done.
And there are requirements around confidentiality and maintaining.
Right. And we can't tell them that. And of course, a lot of people want to know, but due to confidentiality, we can't share what the client's wishes were.
As we close in on the end of this, I put this out here as to kind of, if we could go around and say, what is the most important thing that you think the division should prioritize as they prepare their new plan? If you don't know the answer to that question, but I'll put another one out there as well, which is, what is one thing that we haven't talked about today that you think needs to be part of the plan or might inform the plan? So either of those questions would be, and if we could perhaps start with the service providers and ask you, what do you think is an important thing that should be prioritized, or what is something that we haven't talked about today that you think needs to be in there? And Emily, let me know if anything goes in the chat about this.
Will do.
Can I call you by name? Those of you, let's maybe start with the Yazoo County ladies, perhaps, if I could put you on the spot. And I know you might be thinking.
I'm thinking on that because I just want to make sure that, what is the most, it's so many things that are important with our seniors, and you don't want to miss anything. See somebody put in the chat more funding, and yeah, that's always an issue, isn't it? But oh,
We have 2 for more funding.
okay.
I usually go into these sort of stipulating there's never enough money. I mean, we know that I certainly, experienced that in Indiana, but it's how do we best use the funding that we have, or where are the places to advocate for additional funding, or what are other ways to develop new funding sources?
And Miss Anita, would you agree that one issue we run into most often is the need for right now short-term assistance, whether it be,
Yeah,
2 to 3 weeks of temporary home delivered meals or temporary PCA services in the home, and that's not really the focus of our programs. And a lot of people are of the impression, like home health will tell them, oh, call these guys and they'll put somebody in your home, and it's not magic like that. And so many are under the impression that it is, but Yazoo does not have a resource like that.
Yeah, thank you, Heather. That's a good point. Like if somebody goes into the hospital and they live alone, they go home to no one there to assist them. And if we could do short-term services with homemaker, home delivered meals, that would be wonderful. To do just 6 weeks or something like that, so they can get back on their feet well enough to provide their care for themselves again.
Yeah, I'm most often having to say to them, well, this is where you have to rely on family and friends, your social network, private pay if you can, and if you have no one, it may be a short-term stint for in-house rehabilitation or such that you need. And no one wants to hear that, and many cannot pay the private pay out-of-pocket fees, and the family network is breaking down.
I would say, as far as funding, that is a major thing, and it's like when you short one thing, it triggers to the next. So with the funding, if we had more funding, it's a possibility that where we can get more drivers, be able to get more vehicles that's needed, because there's a great need for the services, whether it be the transportation or the nutritional side. And so I think we're having gatherings like this or summits or something, and invite those decision makers, the legislators and the senators or whoever making these decisions as far as funding. I know funding is just limited, and they can only allot so much to the department. They can only give CMPDD so much, or they can only give MDOT so much. And so, like I said, doing the best you can what you got. And with doing the best you can what you got, you had it kind of make it difficult, because drivers now are wanting a lot of money, whereas the agencies are not able to give that money. And then with these other agencies, you have to have match money. So it's so much, everything's going back around to the money. And so I would say utilizing those avenues that we already have, to the full capacity. Whatever CMPDD has to offer us as subcontractors, accept it, take it, and then the same way with those that are utilizing with MDOT. And then MDOT also has the 5310 program for funding, where for the seniors and disabled, and so utilizing what we have, and then kind of have to come up with some type of a game plan or something to be able to know, okay, we have to have these funding for this area, of that area. So, and that's the only way I see that, the programs will be able to last and stand.
Thank you, Mr. Cooley.
There's comment about more collaboration and partnerships, sharing what resources each program or agency provides and their limitations.
It does, I mean, that is one of the ways in which you can try to make limited funding go further, improve partnerships, improve information sharing so everybody knows kind of what's out there and are passing information and resources back and forth to the best of their ability. Um, and, I think broadly that's something we'll be talking with Kenyatta about what are potential state level partnerships that they can facilitate and how, that might also support the AAAs in that effort. I want to, number one, thank everybody for your participation today. This has been a really robust conversation, and I appreciate it very much. It absolutely will be informing. I know we're recording it, but I have been busy taking notes throughout and starring them and underlining them when I hear things that I think are important for the plan, and look forward to synthesizing that. There is the survey that is out there. This is the link for that. If you are at a provider or if you're in a AAA and you know that people are having trouble completing an electronic survey, if you're willing to sit down and walk through that survey with them so that we can fill it out. It's, paper documents can be like, that is a very hard way to do a survey. But any way you can assist people to complete that would be much appreciated. My email is here. If you are sort of marinating on this conversation and a thought occurs to you, don't hesitate to email me. Emily, of course, is on this call today, not Kyla, but Kyla is working on this project with me. Her email is there as well. And I'm sure that Kenyatta and her team would also be willing to field any comments that you make if you're more comfortable with that. But I definitely thank you, and then I'll turn it over to Kenyatta to sort of wrap us up.
Thank you so much, Yonda, for taking the time out and supporting the development of our state plan. And I also want to thank everyone who joined the call today. This was a very rich conversation. Thank you for your thoughts and your perspectives and your experiences, honestly. Your input is invaluable to the work that we're doing across the state. You're the subject matter experts. We glean from you all the guidance, all the information that you give us to help form and shape this plan over the next 4 years and helping our older adults. So thank you so much.
All right. Thank you. Morgan, I think we'll be ready to close the call now. But again, just one last big thank you, and please don't forget the survey.
Thank you.
Thanks, everybody.
Bye.